range of things that people who are looking at healthcare have to evaluate is pretty spectacularly broad. When I was young, I volunteered for nuclear submarines. I realized when I got on there, and we were out for months at a time, that we had no physician. It's a highly industrial environment, and the people who were entrusted with our care were people who had absorbed enormous responsibility with very few resources. Later, when I became a doc, I went back to the Navy, and I wound up running an intensive care unit in Iraq and in Bosnia and in Afghanistan, where again, the capacity for healthcare was challenged. However, the citizens that surrounded us actually had it far worse, of course, than we did. And I wound up as the director of something called the Medical Evacuation and Repatriation Program for Iraq, MRPI, run by an absolutely spectacular group called the International Organization for Migration, which I believe recently became a formal part of the United Nations. The challenges that they faced in the field and the delivery of healthcare for traumatic injuries, for maternal child health, for micronutrient deficiencies were above and beyond, and the amount of work that it took to accomplish that kept everybody awake, exhausted, hot, dirty, and yet the care got delivered. When we started looking at this, we had a range of possibilities to consider. Did we want something that would extend the capabilities of healthcare providers of all stripes? Did we want something that would extend the material reach of healthcare providers and the kind of things that they needed in the field or in the operating room or in the clinic? Or did we want to expand the techniques that were available, the kind of things that would go beyond conventional medical care into something that was really quite new but might be extremely valuable? The rubric that we were trying to follow was the following: optimal physical and mental health, including access to cost-effective prevention, early diagnosis, and personalized therapy for individuals and communities. We'll tell you more about what we chose to do after the introduction of my colleagues. Kevin?
Hello, I'm Kevin Noble. I'm with Genentech. Genentech's a little biotech down the road from here, and we focus on discovering, developing, manufacturing, and commercializing medicines for people who have very serious and life-threatening illnesses. Key areas we focus on are oncology, immunology, metabolism, neuroscience, and infectious disease. My group works on the commercial side of the equation, and what we do is look at the scientific innovation that's come through the organization and then look at what has to happen in the marketplace to surround that innovation and change the way that medicine is being treated to enhance and extend patients' lives. So my group looks at health technologies, it looks at machine learning, artificial intelligence, and other components to address some key grand challenges. So we work on a process of designing really big challenges for the organization to think about. A few that we're working on now for anybody who has good ideas. We're looking at next generation early disease detection in the areas of cancer and Alzheimer's and rare respiratory diseases, with the goal of moving that identification a whole stage forward. We just finished the Quest Award to search for an open competition to search for solutions to end cervical cancer. We're also looking to see, can we extend the window in acute stroke and use machine learning and artificial intelligence to find new insights in healthcare that help treat patients better and measurably improve patient outcomes. So I was excited to participate in this project and excited in our partnership with Singularity University as a corporate founder, a sponsor of Exponential Medicine, the Global Solutions Program, and now this program here, because it brings us together with people who have diverse ideas, experiences, perspectives, like our winner that we're going to see tonight. And more importantly, it helps us create relationships with really amazing people who share our will, our skill, and our passion to solve major challenges. And that's what gets us excited. And I think the winner we picked tonight brings something like that to the table.
Good afternoon. My name's Trevor Riggen. I'm the regional CEO of the American Red Cross, and as part of the Red Cross, part of a broader movement of the International Red Cross and Red Crescent movement out of Geneva. We have a very simple mission: to alleviate human suffering in the face of emergencies. It's very simple, but the way we do that, most people don't know the different parts we do. You obviously have seen us on television responding to large disasters, the ongoing floods right now in Louisiana, the efforts in Syria with our partners in the ICRC, to the wildfires just up north of us, about 2.5 hours in Lake County just recently. But each and every day we respond, here in the Bay Area, we respond to 2 or 3 disasters. It could be a house fire, could be a flood. Just last night we had 2 house fires in the Mission down the street. And so when we look at that, we provide housing. We're a home for tens of thousands of people each and every year, and hundreds of thousands around the world. We're their temporary home. And those of you who are familiar with business work, you know Dr. Deming, who said the first 15% was the most important. For the Red Cross, we believe that first 24 hours is our first 15%. And we have to get the right tools in place to serve people when we first get them, and healthcare is such a huge part of that. And the tools that we have in place, and innovation, we believe, is the driver to making sure we have the tools ready as we move forward to care for people when they need us the most.
So we had a great time discussing a very strong slate of candidates. It took much longer than we anticipated because they really were each delivering something interesting, worthwhile, and exponential. We elected to choose the CEO and founder, Megan Conroy of Capture Proof. Megan, please join us.
I don't need it. I got this guy. Thank you. Capture Proof is changing medicine one photo and video at a time. And we're optimizing healthcare by removing everyone's favorite waiting room. How are we doing that? We're taking social behavior and applying that to medicine. Every single one of those white lights on the left-hand side is someone taking a picture or a video to better tell a story. But our current method of organizing photos in medicine doesn't work. If you open and scroll what will soon be this, and just for a baseline, Mayo puts 2 million DICOM images into their servers every day, and that requires an appointment, a technician, and a huge machine. And we're talking about the photos that are taken with what's in your pocket. We do this through 3 C's. We look at capture, we look at curate, and we look at collaborate. With Capture, we've introduced a smart medical camera. Capture Proof has a media prescription that can be personalized, overlaid in the active camera. If you've taken an image, we overlay that first image to get the same information time and time again. And then we have computer vision in the active camera so that it highlights shadow and exposure. For curation, Capture Proof allows for comparative organization within 3 clicks. And collaboration enables the entire care team to be on the same page. We did a study with Kaiser looking at post-total knee replacement care. Capture Proof reduced in-person visits by 75% and saved 60% of the resources. This data was published in the Journal of Telemedicine Telecare, and if that video were to play, it would show you an instructional video up top, the patient below, and you can swap it to look at patient versus patient as well. We take it a step further, looking at computer vision in the back end, have the ability to highlight if sutures are in and out of the incision, looking at an EKG kind of wave that comes from movement, so you can look at the delta of a range of motion recovery and know if your patient's achieving the goals that you want. Capture Proof can identify the patients that need to be looked in more and give a doctor a heads up as a clinical decision support tool. We're also working with a world-renowned transplant surgeon out of France, and he's looking at the liver transplant and the health of the organ at harvest. Capture Proof's color index and texture index help to solidify a consistency across all screens so that all doctors collaborating know what they're looking at. We're able to take this and very quickly turn it into this. Capture Proof is on track to change 1 billion patients' lives We're looking to do so by the end of 2020, but we will not be able to do it without partners. So if you're interested in being a part, come by our booth. We'd love to have your help. Thank you.
Got a great panel.
Thank you.
Well done, everybody.